Fox Carolina's Matt Kaufax spoke one-on-one with a Prisma Health doctor who also works at USC School of Medicine, and he has this report tonight for us.
Yeah, well, Tori, Cody, Dr. Helmut Albrecht says that what it really comes down to is overall risk. He says in terms of research, the data, smoking is something they have the most on in terms of susceptibility to COVID, and that from a vaccination standpoint, it's really not a moral or an ethical issue at all. Dr. Helmut Albrecht says that the data is clear. Smoking always kills, but it kills even more swiftly coupled with COVID.
About a 35-year-old smoker will have a risk of about a 70-year-old non-smoker.
He says smoking affects multiple organs, but especially the lungs, the same primary organ affected by COVID-19.
Most smokers, even if they don't have symptoms, have a significantly more limited reserve.
That means the time it takes to go from being a little sick to being on a ventilator and possibly dying is also significantly shortened. He says that's why they're trying to make it a risk discussion as opposed to a subjective judgment one.
If your vaccine allocation is based on who is at highest risk, this is not an ethical question, but a risk question. That's how the list is designed.
He says the same arguments some may use against smokers being included in Phase 1C could also apply to organ diseases caused by conditions like alcoholism or type 2 diabetes.
It's really hard. Do we not give a heart transplant to somebody who has eaten the wrong things? There's a lot of medical conditions that are self-induced or lifestyle-induced.
He says people trying to pick off one group or another doesn't get us anywhere in addressing the real solution.
In the end, as many vaccinated people we have is going to determine the outcome.
His advice to smokers in the meantime?
If you're a smoker, please stop.
Wise words from the doctor there, and he says that we're still a little ways off from Phase 1C, which he expects to begin sometime probably in the late spring or early summer. He says that eventually anyone who wants to get the vaccine will get it, and the more people, the better. Also, on another note, we did check with DHEC to clarify and see if they are abiding by the CDC's qualification for underlying conditions and would use that in their own Phase 1C. We still have not heard back yet. In Greenville, Matt Kaufax, Fox Carolina, the 10 o'clock news.